Good afternoon, everyone. Thank you for your patience. We are now ready to start. So thank you for joining today for this information webinar for the new project call launched under the ERA4Health partnership called InterHeart. So my name is Anaïs Frade, and I'm here with my colleague Martine. We are representing the call secretariat, and this presentation today will be divided in 4 main sessions. So first, we'll have a few welcome words from the ERA4Health coordinator, Cristina Nieto from ISKI in Spain. Then the joint call secretary, which is Martin and I, will give a presentation of the call, the main part and the how to apply to the call. Following that, Marie Forsberg from Norsus will give a presentation on the principle of responsible research and innovation. And at the end, we'll have the presentation of the evaluation criteria given by my colleague Martin from the Joint Call Secretariat. We also have a Q&A session at the end of this presentation. We will also answer your question at the end of each session. But if you have more questions at the end, we also have time for that. You should have on your screen on the WebEx, you should have the Q&A chat box you can ask your question in. If you don't see it, because I know sometimes you don't see it automatically, you should be able to click on the 3 dots on the bottom right of the screen and display the Q&A chat box, and then you can ask all your questions in there, and we will answer them when we see them at the end of each session. So without further ado, we are going to start with our first panelist, Cristina from ISKI. I'm going to stop sharing. Cristina, you should be able to share your screen.
Good afternoon, everybody. Thank you very much for attending this InfoDay. I'm sorry for the delay in my connection. Thank you, Martin and Anaïs, for holding this secretariat of this InterHeart joint transnational call, which we aim that it will be a very successful call in our partnership. My name is Cristina Nieto, as Anaïs kindly introduced me, and I'm representing the coordination of the ERA4Health partnership on behalf of my institution, the Institute of Health Carlos III from Spain. I would like just to share with you some slides for introducing you the partnership. Hope that you can see my presentation. Can you see it?
No.
It's not in presentation mode?
It's not sharing at the moment.
It's not sharing, sorry. I will try again. Wait a minute.
We can share for you if you want.
Yeah, if it doesn't work at all. Yeah.
I will try again, and if not, can you see it now?
No.
No.
Okay.
I
will. Don't mind, Anaïs, to share it.
Yes, I have it.
Thank you.
Let's see this.
I have it open again. Okay, sorry.
And
Thanks a lot. Thank you, Anaïs. Next slide, please. So the main aim of ERA4Health partnership is to foster the European collaborative research funding, creating a flexible funding body for fostering joint programming in different priority areas that will address the European public health needs and aims to set up Europe at the forefront of science and innovation in health research by 2050. We have different specific objectives in this partnership. such as supporting relevant medical research, including different clinical fields and intervention areas, improving the utilization of existing health technologies in clinical practice, building capacity, particularly in the designing and conducting of clinical studies initiated by investigators at European scale, and implementing and developing responsible research and innovation in multiple ways. Next slide, please. ERA4Health is divided in two different phases and is directly related with previous existing ERANETs in the different fields, such as nanomedicine, in neuronanomed, and ERA-CBD in the cardiovascular field and other related areas. The first phase of the partnership has a duration about 2 years, and we have in this first phase launched different joint transnational calls in our research priority areas such as nutrition, diet and healthy lifestyles, cardiovascular diseases, and nanomedicine. And that's why this call in InterHeart is framed in this one of these research priority areas such as cardiovascular diseases. We have additionally developed a framework to support multinational investigator-initiated clinical studies, and we have also been able to launch a first pilot call for fostering this type of clinical studies in the end of the last year. In the second phase that will start at the end of this year, we aim to launch also additional calls in research priority areas, as well as calls for clinical studies initiated by investigators. And we are incorporated at this moment new funders that are willing to fund this type of studies. Next slide, please. Our partnership has 37 partners from 24 countries, covering most of them members of the European Union, but also third countries associated to Horizon Europe, and additionally to third countries, Egypt and Taiwan. Next slide, please. Our strategic research and innovation agenda is publicly available in our website, and it covers, as I mentioned before, different high priority research areas such as nutrition, cardiovascular diseases, nanomedicine, prevention and public health strategies, etc. But we are also updating this area with the research areas that will be addressed by the multinational clinical studies initiated by investigators. Next slide, please. So far, we have launched 4 joint transnational calls that have already finished in different research priority areas such as health equity, focus on the health equity through promoting healthy diets and physical activities, CardioNov, focus on also in the cardiovascular diseases, NutriBrain on the modulation of the brain aging through nutrition and healthy lifestyle, and NanotechMech for the nanomedicine field. We have been able to fund successfully different funded projects, more than 60 projects. And in this, as I mentioned, 2 additional calls are currently running, one focused on clinical studies and this additional one, InterHeart 25. Next slide, please. Additionally, the partnership is focused on other activities, such as the development of an early career network for englobing the different early careers that are in our funded projects to connect them, such as dedicated publications, newsletters, periodically newsletters, communication and dissemination activities, also capacity building activities. I suggest that you consult our website in which the different activities of the partnerships are announced. And we have also in the mean of identification of barriers for translating health research into practical applications. We have as well developed a portfolio of synergies with other European initiatives and research infrastructures. Next slide, please. Additionally, I would suggest that you consult our website in which we have published our guidelines for RRI. The RRI experts will get more into detail of these aspects, but we would like to present you these guidelines that are publicly available that you can consult, of course. Next slide, please. Thank you very much. So that's all for my side. It was just a very brief introduction of the partnership and our activities. Hopefully that this InterHeart call is very successful and is interested for all of you. And we are aim to receive your applications. Thank you.
Thank you very much, Christina. for this presentation. Is there any question for Christina in the Q&A, Martin?
Not directed for Christina, but maybe I just can say to everyone that the slideshow and the webinar will be published on the ERA4Health website in the coming days.
Thank you, Martin. Okay, though I'm gonna share my screen now. Okay, we did already. All right, thank you, Christina. I know you have other applications. Thank you very much for participating today and answering everything. So let's keep going. Martin and I are now gonna present the call. So as I said earlier, it's the sixth joint transnational call under the ERA4Health partnerships. It's meant to study the understanding the interaction between cardiovascular disorders and comorbidities and / or their therapeutic treatments. So InterHeart for short. So in this call, there is 14 funding organizations participating. They represent 12 countries. There are Belgium, Denmark, Spain, France, Hungary, Italy, Latvia, Lithuania, Poland, Slovakia, Turkey, and Taiwan. So also 3 European regions are represented. There are 2 in Belgium, Wallonia, Brussels, and Flanders, and 1 in Andalusia in Spain. So the total budget for this call is about 10.7 million euros. And the French National Research Agency is responsible for the joint call secretariat for that call. So this is my colleague Martin here and myself. You can reach out to us if you have any general question about the call. You can use this general address, which is interheart@agencerecherche.fr. It was directly arrived to Martin and I, or you can join us by phone if you need to. So regarding this specific presentation, I will start by going over the scope of the call. Then I'll go over the eligibility criteria, the partner search tool you can use to find partners. Martin will present the pre-proposal template, and we will go over the submission tool. I will show you what it looks like. So let's start with the scope of the call. So the aims for that call is to support research that build understanding of molecular and cellular mechanism governing interaction between the heart and other organs during pathological states of either of them or both of them. Also to support research that builds a comprehensive approaches to understanding cardiovascular disease interaction, combining basic research, clinical translation, and digital innovation through an international collaboration. Finally, the aim is also to support research that enables transnational collaboration of multidisciplinary scientists from different countries to work together across borders, taking advantage of complementary expertise and leveraging diverse patient population and sets of data. So for this call, we have 3 main topics. First topic your proposal can focus on is how cardiovascular disorders affect the performance of other organs / system and their capacity to respond to treatments. Second topic is the counterpart of that, which is how disorder other than cardiovascular disorder affect the cardiovascular system. The same thing, also including the response to treatment. The third topic is how treatments for disorder other than cardiovascular disorder, so treatments for other disease affect the performance of the cardiovascular system. That could be positively or negatively. The different approaches you can include in your proposals. So it could be mechanistic experimental research, identification and validation of biomarkers of crosstalk between organs of system and disorder, so cardiovascular system and other organ in a pathologic state, or the opposite. That include epigenetic biomarkers. And the third approach you could use is the generation of digital models of diseases to study disease or disease-drug interactions. There is a couple of things that are excluded from this call. First, except for small-scale clinical studies up to phase 2, the other clinical studies are excluded. Proposals that are not dealing with cardiovascular system or cardiovascular disorder will be rejected. Proposal that only studies the cardiovascular system or cardiovascular diseases without studying any interaction with other organs, other disease, or treatment will be rejected. It has to be interaction. Studies on how cardiovascular treatment affect the performance of other systems will be rejected. Any development of therapeutics was excluded from that call as well. And finally, all infectious diseases are excluded from this call, even if it's studies with cardiovascular disorders. Some important points about the studies. When applicable, you should use existing biobanks or an existing cohorts. If you do not, you will have to justify why you cannot use the already existing data. All the applicants should consider potential social moderators on effects such as age, sex, gender, and ethnic or other demographic feature differences in the respective research approaches. The cross-validation of research results across different ethnic groups and different social cultural groups is strongly encouraged. Some important general points. So for this call, the duration of the project is 36 months. Your proposal must demonstrate potential health impact and or economic impact and added value of transnational collaboration, the added value of working together. You must follow and respect the RI principle, responsible research and innovation. The application of bedside to bench approach is strongly recommended. Ellen Mary will tell you more a bit later. You should balance gender as much as possible in your consortium, and you should balance responsibilities between genders. And finally, we strongly encourage the participation of early career scientists in the consortium. Let's go over the eligibility criteria, except if there's too many questions. Martin, you want to answer now? Let's go over and we'll finish at the end.
Maybe you can go a bit further and until the participant and then you can answer the question.
I see a lot of things popping up, so I wasn't sure if it was already too many. All right, let's go over the eligibility criteria. The funding modalities. So every applicant, every partner within a consortium will be funded by their respective national or regional funding organization. So each partner needs to check that they are eligible for funding by their funding organization. They need to follow the funding organization rules. So for that, you can consult the Annex 1 of the call text. Here is just an example, so it's for Taiwan, but in the annex, you will find the country, the funding organization, the person you can contact to have more info, the funding commitment, the maximum funding per project or per partner, what is the funding organization maximum is, what partner are eligible, what costs are eligible, and if there is any information that needs to be submitted directing to them. For some organization needs a different application, like there's the application you need to do generally to the within the system for the joint call secretariat. Some funding organization have another level and you need to submit information to them. So you need to check that. For that, you have the Annex 1 and you can also reach your national contact person. Just remember that if you have a partner that is not eligible for funding in your consortium, that could lead to the rejection of the entire proposal before even being reviewed, because you won't have the necessary partner in your consortium if one is not eligible. But know that if you have a partner that is not eligible, they might be able to participate as a collaborator on their own funds. I will talk about that a little bit later as well. So the thing you need to pay attention when you look at the rules of each funding organization is what are the entities that are funded by this organization: academia, clinical, enterprise, or stakeholders. You need to pay attention if your funding organization is funding the type of studies you want to do. Do they fund preclinical, clinical trials? This is the kind of thing you need to pay attention to. What is the maximum funding that are given per partner, per coordinator, or per project, depending on the organization? What are the costs that are eligible that I can ask budget for? And finally, what I was telling you, if there is additional documents that need to be submitted at the national/regional level. So again, if you have any question, any doubt about the rules, the national, regional rules, you can reach out to your national contact person. They will be able to answer any question regarding that specific call. All right, now let's talk more about the general rules of the call regarding the composition of a consortium. So what type of partners are eligible to apply to the call as a general level? So academia, clinical public health sector, enterprises, operational stakeholders, they're all eligible to apply for this call. It is recommended to include partners from different categories, obviously according to your work plan and what you're doing. The size of the consortium. So there is a minimum of 3 eligible partners, maximum of 5. The partners have to be from at least 3 different countries that are participating to the call. So 3 eligible partners applying for funding. And no more than 2 eligible partners from the same country. There is a special rule for underrepresented country, knowing that an eligible partner from underrepresented country in the consortium allows to increase the total number of partners. For example, if you have 1 partner from an underrepresented country, your partner can have a total of 6 partners. If you have 2 partners from an underrepresented country, your consortium can have up to 7 partners total. So for this call, the underrepresented countries are the following: 1, Hungary, Latvia, Lithuania, Slovakia, and Turkey. Now regarding the collaborators. So what are collaborators? Collaborators are self-funded partners. They are not applying for funding. They are participating on their own funds. They can be from countries that are not participating to the call, or they can be from a country participating to the call but not eligible for funding under the rules of the funding organization, for example. So what are the conditions for them to apply to be part of your consortium? There's a maximum of 2 collaborators per consortium. They must demonstrate a clear added value for the research project. They must demonstrate that they have secure funding for participating. They will have to provide a letter of commitments that will be included in the proposal. And a collaborator cannot be a work package leader. Some examples. So your composition of the consortium. The smaller consortium you can have is only 3 eligible partners from 3 different countries. That works. The biggest consortium you can get is 9 total partners, 7 eligible partners plus 2 collaborators. So you would have at least 3 eligible partners for 3 different countries, but you also need to include 2 eligible partners from 2 underrepresented countries. So then you can go to up to 7 eligible partners plus 2 collaborators. Some other general rules. Each principal investigator can submit 1 proposal as a coordinator or up to 2 proposals as a simple partner. The submission of the proposal is only done online through the PT Outline platform that I will present later. And you need to submit your pre-proposal by March 7 at noon. And finally, you must respect the pre-proposal template. Martin will present the pre-proposal template later, but there is no figure except in the work plan with no supporting layer, no extra documents, no extra CV, and you need to respect the maximum length of the proposal template. Anything that is over, and we'll have to cut it. In the proposal template, the first page is actually a checklist that you should be able to tick all the boxes to make sure that you have ticked all the eligibility rules and make sure that your consortium is eligible, your partners are eligible, your proposal is eligible. If you have any questions about the general rules, you can reach out to the Joint Call Secretaries, which is us, Martin and I, and we'll answer your question.
I guess maybe we can make a break here to start to answer to the questions.
Okay.
So did I understand correctly? If you didn't participate in the first stage, you cannot participate in the second as well.
Yes, that is correct. So this call is divided in two phases. There is first pre-proposal. You submit pre-proposal that are going to be evaluated by reviewer, and only the one that will be invited to the second stage will be invited to submit their proposal. You cannot just start at the second phase. You have to submit at the pre-proposal phase.
Thank you. Is Portugal eligible to participate as a partner in the InterHeart Call?
Unfortunately, the Portuguese funding organization is not participating to the InterHeart Call, so Portuguese partner will only be able to participate as collaborator on their own funds.
Can you please inform us when AI from Spain will update information regarding requirements for Spanish participants?
Yeah, I think with us, Martina can probably come up. You're back. We can hear you.
So can you, so the Spanish participant requirement has been updated today in the website and in the call document and the guidelines. So if you go to the website, you can now upload the call text with this updated version from AI.
We did not hear you what was the question, Martin?
I think you were disconnected. For this reason, you didn't hear it.
Oh, I thought you were disconnected.
In the latest version of the call, it was stated that Spain Regional Ministry of Health and Consumer Affairs of Andalusia and the State Research Agency, AI, not just Andalusia, it has changed. No, CSCJA and AI are the two Spanish partners participating to the call. So there is no change on that. It is a cardiovascular call, but it states between heart and other organs. What's about vascular aorta itself? Indeed, the call really, any proposal should involve a cardiovascular system and another organ. We cannot work only on cardiovascular system or other organs. It should be a combination of the both. Is the development of new diagnostic method in the context of the interaction between the circulatory system and other organs within the scope of a call. So in the context, we especially highlight the identification and validation of biomarkers to understand this interaction between cardiovascular system and other organs. But diagnostic tests are also not out of the scope of a call. So if you are already some biomarker and validate one, and you can go further in your research, this is completely in scope of a call. Someone asked to see again the slide number 10.
The slide number 10. Okay, which one is that?
I'm going on with a question. Is it just focus on heart or CVD system as blood cell and vessels? It's focused really on cardiovascular systems, not only on heart. So it can be vessel and white blood cell. I'm not so self-assured about that. I'm very sorry about it. This is not my main discipline. But if blood cell is really a part, by definition, of the cardiovascular system, yes, you can focus to blood cell and vessel and another organs. There's no problem with that. Can be diabetes or hypertension considered as comorbidity affecting organs over that CVDs? Yes, indeed. Such a disease can be studied along with cardiovascular disease. Is it possible for patient association to participate? So yes, they can participate. However, the funding rules often doesn't allow to fund them. So you should find another way to incorporate them in your projects as collaborators or maybe sometime as advisory board. I think we will come back to that later on. Can charity be funded? This is really depend of the eligibility of each funding organization. So when you know which country belongs to charity, I think the national point contact should be contacted, and the possibility of participation of charity could be confirmed with this person. Would perivascular adipose tissue be considered as another organ system and eligible for this project? I'm not so sure how to answer to this question, but it's probably not out of the scope of a call. As far you are studying it with the cardiovascular systems, are inflammatory cell, T cell, macrophage monocytes considered as another system eligible for the call? Yes, inflammatory system could also be studied. I think that's not a problem, especially if you are linked with inflammatory disease. Is clinical research automatically excluded? So as mentioned, Anaïs, only the early phase of clinical study can be is included in this call. After the phase 2, so the phase 3 is not eligible for this call, especially because clinical study needs some other way to be found. And this for this reason, ERA4Health developed a funding instrument to fund clinical studies. So unfortunately, if it's up or after the phase 2 is not eligible. If it's before, it is eligible. So Anaïs is going to present the matchmaking portal when we have reviewed all these questions. So I will not go to this question now. Are pulmonary circulation disorder eligible for the call? The study of pulmons is with a cardiovascular system is eligible. If you study only pulmonary circulation disorder, this is not eligible. What is a collaborator benefit, like patient association or industrial partner, to be a part of the consortium? If we cannot include them in the budget, not sure how we can convince them to do some part of the work packages. Can you give some example of previous consortium? Thanks. Well, industrial as collaborator, I mean, that's is more, if you include the industrial as a collaborator, sorry, is more to have a view and to expect some impact of your project in the later phases, because now you are doing research, but maybe this research can be uptake later on. So that's maybe important for the industry to be a collaborator or to be a part of advisory board to be sure that the research, when after the result of the research, could be used. And the advantage of patient association is that the research that you're doing is really going to reach the patient at one point. So we will come back to this topic with a presentation of Ellen Marie Forsberg about RRI. Well, as you know, ERA4Health is not is still quite new, so we don't have yet some project which has ended. But we have several projects with some collaborators, and also actually also industrial partners sometimes can be eligible for funding. It depends on the funding organizations. So I hope I could reply to this question. So yes, vessel is included in cardiovascular systems. This reason why many people are asking about heart-based cardiovascular system is that quite often it's only about the heart. We work on the aorta only, and its relations with other organs, so not heart. Yes, it's cardiovascular system. It's not only heart, it's cardiovascular system. Can fetal cardiovascular functioning be included in the proposal? Yes, if it's linked with other organs or other disease, but it cannot be focused only on fetal cardiovascular functioning. And it was normal that the slide was not progressing as we were replying to the questions. There is also some question in the Q&R. What is, oh, sorry, I have some chat going on. What is a partner? A site, hospital, lab? Or can several labs or sites belonging to the same institution be considered as a single partner? So a partner, I think the same. The definition is usually like research organization or hospital. But then if it's a site or a lab, this really depends on the funding organization rules. So please ask the question to the national or regional contact person. Will it possible to receive a concession? I already expressed that it will be published on the website. Is clinical research automatically excluded? So clinical research after phase 3 is excluded. If it's before phase 3 up to phase 2, this is eligible. Which is the definition of early career? You say that it's important to be inclusive toward young members of the consortium, but I didn't find the definition of this career stage in the call or elsewhere. Thanks. So this is can be master student, PhD, or postdoc. So pulmonary circulation is included in the cardiovascular system. I'm really sorry about that, but I'm not able to reply this today. Maybe we can this question by email, and we will consult our experts to better understand.
Thank you.
I review all of them.
Thank you, Martin. Yeah, regarding the pulmonary, yeah, do not hesitate to send an email to the call secretariat, and we will get back to you. Thank you all for your question and your enthusiasm. I will now present the partner search tool, and then we can come back to more questions after. So the partner search tool is a platform available on the ERA4Health website to help you find partner or projects. So if you go on the ERA4Health website and funding opportunity and you click on partner search, you will have access to that tool called Port Finder. So on this page, there's not a screenshot of all the page, but you have a tutorial of how to use it. And at the bottom of the page, you have the direct access link. So once you click on that, you arrive on the platform. This is what it looks like. You can see here are people that are looking either for partners, some people are looking for projects. Those people are from the USA, looking from different countries. So there's all those people looking for other people. You can use the advanced filter tool to help you sort through that. Within that, you can either pick the ERA4Health partnership, or if you want to be even more specific, you can go ERA4Health GTC6 InterHeart. And you can choose the type of collaboration if you're looking for a partner, if you're looking for a project, what type of partner, if you want academia, enterprise, etc. If you have any keyword, and then you'll have a list of people that are looking for project or partner that can help you compose your consortium. The submission process, the steps to complete your application is to complete the consortium information on the submission platform PT outline. So I will present the PT outline platform after, but you have to complete all the information on the platform. And on the platform, you will be able to download the pre-proposal template. You can also download that pre-proposal template on the ERA4Health website if you want. So you download that template, you complete the template, still respecting all the format and respecting that template, and you upload that template on the PT outline platform. After completing your information, you can upload it. The deadline for the submission of the proposal, again, is March 7 at noon. And Martin will go over the proposal template now.
Yes, thank you, Anaïs. Next slide, please. So to submit one proposal, the coordinator should submit one proposal for all the consortium written in English in our electronic submission system, which is PT Outline. And so this is the address. So I'm going now to present you the template of the pre-proposal. Can you see it? Thank you. So the first page shows you again the deadline for the first step submissions, also the characteristic of the font and the size, and also the paper format and the margin. So this document is already set with this format, so please do not change it. As I mentioned before, we should the coordinator should submit one proposal for the whole consortium. And this is already some remark that we did before. And here, then follow the checklist for a coordinator that Anaïs already presented to you. And then start the page where you have to fill. So there is the section A with the general information, so project title, acronym, duration, the total project cost, and the total requested budget. Or we ask you to estimate the technology readiness level of your project, and to be sure that we are all the same definition, we indicated them here. Then you should tick one or several topics according to what you are going to study, and also one or several approaches that you are going to develop in your project. Design some keywords for your project or proposal, and also write an abstract of 2,000 characters. Then you should present the consortium. So first, the coordinator, which will be the partner 1. So we ask the name of institution, the department, the position, address, city, country, and type of entity. And then we also ask the same information for different research partners. So then we will start by the partner number 2. Please do not change the numbering. And you can have some line until 7 according to the size of the consortium. Otherwise, you can delete. You can see that you can find some recommendation or some information in the template here, for example. Please do not delete them, keep them in the proposal template. So after presenting the coordinator of the partners, you have to present the collaborators if you have some, so maximum of 2. Then start the project descriptions. So you can see also here that each time in red, it is written the maximum page that you should write. So please respect this length. And so we start by the project background with background and current state of the art, the description of the knowledge gap and unmet medical societal need, or technical or implementation challenge that addressed by the proposed work. And so it is asked to highlight any prior work related to proposal and preliminary result obtained by the consortium. Then you need to describe the aim of the project with the partner assigns to develop this aim and also the workload, the relevance of the aim of the goals, the work plan. So here we are expecting a description of the different work packages, which will should present the objective, rationale, and methodology, highlighting the novelty, originality, the feasibility of a project, the expected deliverable, transferability of a proposed research to human health, and also if you are using some existing biobank or existing cohorts. In this case, they should be well described. Clearly define the role and responsibility and workload of each participating research partner, and comment on how participation and integration of partner in the project is allowed and facilitated, and comment on how the management of the proposal will be achieved. Then you have a table to fill, which will present the different work package with a person month for each research partner. Then you should present a work plan and timeline as a diagram. So it's mostly a Gantt chart or a PERT or similar scheme. It's really important that the charts can be easily read by the evaluators. Like, for example, it's often that we see in the Gantt task 2.2, and we see the period where this task is going to be achieved, but this means that the evaluator needs to go back up to see what is correspond to task 2. So please be precise. That will be really useful for your proposal. You need to present the expected add value of a transnational collaboration and the potential for a long-term international network. Then you should present the responsible research and innovations and other cross-cutting issue in your projects. So the general ERA aspects, the stakeholder involvement, and for the project with high potential of applicability or short, medium term, you should also develop the expecting time for the market and transfer to patient toward clinical and public health application and so on. And finally, ethical considerations. But the next presentation, Hélène Marie is going to describe more about the RI. Then you have one page which allows you to write the references. And then you should present the scientific justification of a requested budget. So the budget is presented in a table format for each partner. It is asking the cost of the personnel, the consumables, equipment, subcontracting over direct costs, and overheads. And for each categories, you need to put the money that you are requesting to the funding organization, but also if you have some in-kind participations, this means money that you don't ask to the funding organization, but you have already. For example, for personnel, if the PI already have a permanent position, maybe is not eligible for a funding organization to declare his salary, but then it should be indicating this line. And the same for consumable equipment, subcontracted. And it is also important to note that we expect that you are planning some travel expenses to the participation of the coordination and or the national partner leaders at the intermediate or a final status symposium to present the result of our project. And also ERA4Health, one of its activity is to animate, or not really animate because this is the early career scientists who animate it, but we have a big early career network. And we expect you also to have some money for at least one of these early career network and go to a meeting with this early career network. So the overheads correspond to the indirect costs. Maybe you prefer this definition. But it should be indicated by the funding organization in their annex to what corresponds overheads. And this annex 1 is, you can find it in the code text. Then we ask for a CV of each principal investigators. So it's really important to note that there is no co-PI. We should have only one PI per partner, and so only one CV. And the CV shouldn't be more than one page and should present the personal information, expertise, role within the consortium, the 5 most relevant publications of the last 10 years, and additional information as honor, awards, membership of references. Then there is some information requested for the collaboration, the collaborator. So the country, the name, institutions, and type of entity. And the collaborator should also present a letter of commitment, which should be signed by the director of the institution, which is really important. And this letter can be fused with this template and be submitted on our platform. Then you have different conditions of GDPR, and each partner should declare its willingness to cooperate with a research consortium and to declare to not receive other public funds to perform the described task in these applications. And it should sign. So here this is fine, but the PI is signed only. Yes, just something that I want to say about the budget that I forgot, sorry for that. It's really important that each partner participates to the conceptions of his budget, because the budget really depends on national regulations or regional regulation, and the coordinator cannot know and cannot understand all these rules. So it's really important that there is a big collaboration of a consortium to generate this budget. And yeah, because also sometimes we can see that all partners is asking for the same sum, but this is really not possible according to the regulations. This looked like the consortium didn't work on this budget. So this is here.
Thank you, Martine. for this presentation. I will take over and keep going with the presentation. Oh no, you have a few yet. Sorry. Let me share that. All right.
Yes, so just to remind that we have some information in the proposal template that I'll show you, but also on the PT outline platform. So this is for different reasons, because proposal template is really clear that it's for the evaluators and also for the funders to have a plan of your work. But also we need this data, some of this data on PT outline, because we need to extract all this information at once in one file. We cannot go for all the proposals submitted to collect all this information. So it's really important that the information on the proposal template and on the PT outline are similar. So in case that there is some inconsistency, in the information, we will look at the information which is submitted in the electronic submission tool. Next. Yes, so it's really important to respect the deadline, and I think we can remind it again. So the deadline to submit for the third phase submission, the pre-proposal, is March 7th at noon, CET.
Thank you, Martin. Okay. Yes, I just wanted to, avoid submission at the last moment, because on PT outline, sometimes if everybody's submitting at the same time at the last minute, it can crash the platform, and that would be really sad. Thank you, Martine. I will now present the submission platform we've been talking about this entire time, PT outline. So this is the address to access the PT outline platform. This is what it looks like. I'm going to directly share with you the platform, the website. I've created an account for that. Okay, I'm going to try to zoom in a little bit. So this is what the platform looks like when you connect when you follow the link. So if you already have an account from applying to a previous call, you can use your credential, otherwise you can sign up. If you forgot your password, you can recover your password. So when you connect to the platform, this is what it looked like. Okay. So here I already created a proposal as an example, but you will have here the possibility of creating a new proposal. The button is active, but if I click on it, it will tell me that I can't, because you can only submit one proposal per person. So you have all the explanation here, and you have the menu on the left. So overview is the page we're on right now. On the privacy page, you have general question about that you agree to share all your information. Then the general information will be the name of your project, the TRL, the topics, your abstract, the keyword, and a popular science summary. After that, you will have to share the project coordinator information. So what is your organization, your city, country, all general information, your name, your career stage, your information. And then here you will have the financial plan. So this is where you're going to enter the same information that you enter in your per-proposal template: personal cost, consumables, equipment, subcontracting, other direct costs and overheads, and then the total. So that's where we were telling you this information needs to be consistent between what you have on your template, on your Word document, and what you enter in the platform. If this is not the case, we will prioritize what is on the PT outline platform. So please make sure that you enter the same information. Once you have and put all this information that you, Sorry, I should not have some fast. So once you're in the bottom of your page, you click on Save. Once your information is successfully saved, you'll be able to click on Project Partner. Same thing, you will have the same information to complete for your project partner. And an important thing is you need to go all the way down. Even if you don't fill all the fields, you need to go all the way down and click on Save to be able to add the next project partner. As long as you don't save the partner, you won't be able to add another one. Once you save, this little button will appear here, Add Project Partner, and you can add a new one if needed. So you had as many project partners as you need. Each time you save them, you can add a new one. You save them, you can add a new one. Project description. This is where you're going to upload your pre-proposal template. So please do it in a PDF format. So once you complete your pre-proposal Word document, convert it in PDF, and you can upload it here. Same thing, you save. And the last menu will be final check and submission. So you will have a summary of what things of my tests are here, like what is requested, what is the total funding. You can click on verified submission first, and it will tell you. Mine is telling me I cannot submit because I have an error somewhere. Here in orange, this one is telling me that I have an error in my project partner. So when I click on it, I arrive directly here, and it's here. It's telling me the country field is required, which I did not. So if I complete this country, for example, Belgium will be more appropriate. That doesn't really matter, but Belgium, go to the bottom of the page, you save, it's all happy again. There is no more like orange thing telling you you're missing something. You go final check and submission, verified submission, and then I would be able to submit. I am not going to do it for the test, but you would be able to click on submit now. Once you click on submit now, it's final. You cannot do any more change. So be sure that you're ready to submit, because after that, there is no more change possible. So that's basically it. One thing I would like to highlight, when you enter your project partner on a PT Outline platform, please do it in the same order than it is on your pre-proposal template. It's making things much more straightforward for the application. So please remember to try to keep the same order on the partners, knowing that the project coordinator will be like basically partner 1, and then it's 2, 3, 4. Yes, that's about it. If you have any problem, you can contact us. There's a help desk, but you can directly email us, because even if you contact the help desk, they will come back to us generally. Yeah, the support here, but they will come back to us. So that's about it for the platform. I will go back to what am I sharing right now? Yes, submission platform. That's about it. I wanted to conclude this presentation by saying that everything that we presented today is, at least for this session, is in the call text. You can find all the call on the call documents. You can find all the call documents on the ERA4Health website. You go funding opportunities, InterHeart 2025, and we'll have access to the call text. There's the link for the submission platform. There's the pre-proposal template, and there's some guidelines for applicants and FAQs. So those guidelines are information that are taken from the call text, but much shorter. So you can quickly have visibility on which partner are eligible, what are the maximum amount. If you're a coordinator and you're looking for who could be your partner, you can quickly see what are the categories depending on the funding organization. And then some frequently asked questions that would be about eligibility, about PT outline, about collaborators. So please check all those documents. For your information, the recording of this webinar will be available on the same page. will be also funding opportunities InterHeart, and there will be like a link right here, so you can, if you need, you can watch this webinar again. Again, if you have any doubts, any question, general question, you reach out to us, John Call Secretariat. Any specific question on your funding organization, you go to the Annex 1 of the call text. You can find the name of your contact person. You can ask them any question. Oops, sorry about that. Just one thing I wanted to announce, there will be a webinar given within the firm of ERA4Health on January 29th at 2 p.m. It will be about the mechanism linking GLP-1 to reduction of cardiovascular disease and associated comorbidities. So it's this is link. It's not just about, the call is not just about that, but it is related to the call. So we wanted to announce it here. To register for that webinar, you go to the ERA4Health page, you go on Home, News, Let Us News, and there will be a link to register to a webinar if you're interested to attend. So that will be all for me. Martin, you want to answer some question at the moment?
Maybe we keep as we plan to answer the question at the end, and we give
Yeah,
the floor to Ellen Marie.
I think it's a good idea. So next will be Ellen Marie, Ellen Marie Forsberg from Narsus, that is going to present the principle of responsible research and innovation. I will stop sharing. I think you should be able to share your presentation, Ellen Marie. Yes, perfect.
See it?
Yes.
Good afternoon, everybody. I'm Ellen Marie Forsberg. I'm from Narsus, and I will talk about responsible research and innovation a little bit in general, and then more specific. Do you still see it? Because it seemed like it was lost. You see the presentation? Yeah, good.
Not anymore.
So
you're right. The presentation disappeared.
Oh, it disappeared. Let's try again.
I was seeing my own presentation.
Yeah, now?
Yes.
Yeah. So you may be familiar already with responsible research and innovation, but I will talk about it in general for those who are not. It's about doing the right science right. And it's included in this program and in other programs, funding programs as well, because it's important to ensure that taxpayers' money are going into research and innovation that is seen to benefit society and not create additional harms. And it involves engagement of publics and societal stakeholders, because there is this desire to make sure that science is kind of properly integrated with societal values, and that societal stakeholders should be included into decisions about what is good and bad in science, what is acceptable harm, and what are the desired benefits. So the background kind of thinking or philosophy of RRI, as we say, is about the social responsibility of science. So what kind of science do we want? What kind of directions of research should we take? Who might benefit from that? Who might experience new risks? And is that balance of risks and benefits fair? And how can we consider all the social, ethical, and environmental issues throughout the science and innovation process? And RRI is a discourse and a set of tools, you might say, to think about these questions and ensure that both scientists and funders and technologists don't lose sight of the context while doing research. So it's both a philosophy and it's very kind of practical set toolbox. You may have come across RI also in the context of the European Commission framework programs, especially in Horizon 2020. It was very important. This is a kind of more overall philosophy from the European Commission, where they say it's about assessing and anticipating implications and fostering inclusive and sustainable research and innovation. So you might say in bullet points, RRI is about, in an inclusive way, to address societal needs, avoid undesirable side effects, integrate responsibility into research and innovation practices, and engaging with stakeholders, but maintaining the responsibility within the, of course, the science and innovation communities. And when we talk about responsibility, we talk about in a broad sense, so including social, ethical, environmental, political, or even cultural issues. The approach to responsible research and innovation taken in ERA4Health is an approach that is taken many places in Europe. Here is an example from the EPSRC. It's now called UK Research and Innovation. Their framework for responsible innovation is, we often talk about as the area or AIR framework. So if you see to the left, it's about anticipating effects of science and innovation, about reflecting on values, about engaging with stakeholders and the public, and also about acting. So that means to be willing to and able to respond to what you learn in the process of reflecting and talking to people. We also have more or less the same framework in Norway, and there are many aeronets that also apply this kind of RI framework. So what you've heard already several times about the RI requirements in InterHeart. So it says that proposals should be aligned with RI and demonstrate a commitment to investigating and addressing social, ethical, political, environmental, or cultural dimensions of the proposed research. And they refer to the proposal template and also the ROI guidelines, which is a separate document that both kind of explains the rationale of ROI, but also tries to be quite practical in the approach. So giving examples of how you can include ROI into your proposals and, of course, into the projects if they are funded. So here are the guidelines, and you can find them. And again, here we recognize the same dimensions that I mentioned already. It's about anticipating the effects of the research and innovation that is being planned, benefits, potential risks, what can we do in the project to minimize risks and maximize benefits. Inclusion is about deciding who in your context, in your project, are the most important societal stakeholders or parts of the public that should be involved in the research. It's about two-way communication. It's not about simply disseminating. So it's about bringing people into the research process. And then reflection is about actually thinking through why you're doing, what you hope to achieve, whether there is a common understanding in your consortium about the values that are at stake. Also reflecting on value choices along the research process. Their methodological decisions can have value aspects, and take the time to reflect on that. And also in the proposal phase, build that into the plan. And related to this is responsiveness. As I said, be willing to let yourself be affected by what you learn. So find out where key decision points are and how that can be informed by your ROI activities and your dialogues with the publics. So ROI is not a straitjacket. It should be tailored to your particular project. There will be many different kinds of research projects that need different kinds of RI activities. So it has to make sense. It has to be related to what actual social and ethical issues are raised by your project. And it will be different when you have very foundational or exploratory research. You may want to have a more exploratory approach to RI, perhaps using scenarios or other tools. Disruptive, really path-breaking research that might have large consequences that we don't know about now may require a more substantive approach to RI than simply incremental research. And the reviewers that will review will also assess your RI approach relate to the overall context of your research. So in practice, when you develop your proposal, think about who will benefit from your project, who may experience new risks, and are these examples or these answers acceptable to you? And if not, how can you rig your project to be more acceptable? Think about who your stakeholders are, and also if you've considered involving the public in any of your activities. Think about having good deliberative spaces for your project team, and that's typically in the consortium meetings, like having a 1 hour every meeting for discussing values, for instance. Think about the choice of research methods regarding ethics issues in the project. Think also about issues, other cross-cutting issues that have been mentioned, like gender and diversity or equity between partners in your research consortium. Think about safety, efficiency, and if relevant, environmental impacts and the sustainability of any kind of technologies or solutions that you offer. And these are just some examples. Have a look at the RI guidelines for more advice. Just emphasizing a few more aspects that will be assessed by the reviewers, and there will be RI experts also involved, advising on these on the way to assess RI. And then these people will look at to what extent RI is actually integrated into the project. So kind of just giving a few hours, a small budget to someone kind of external to the project, not really influencing the work in the project, it's not going to be evaluated as positively as when it's really integrated into the consortium and into the decision points in the project. Try to get a shared understanding of the project's ROI aspects already in the proposal phase, and make sure you have time to get that as early in the as possible in the actual project if you get it. Don't just write nice words, but show what it means in practice. And think about the scientific and the ROI components in tandem, because the methodological choices you make will also or might also influence the ROI part. And make sure you adequately resource ROI. So it's something that it needs to be shown in the proposal that you're actually going to do it. Some milestones, some deliverables, some budget, some expertise. Show that, and that will be favorably evaluated. So these are just some examples of how you can include RI in your project. Maybe a separate work package on ethical issues if relevant. Can you have societal stakeholders in your advisory group, for instance? Can you organize a citizens panel or even a couple? Could you have workshops with societal stakeholders or other ways to engage people in RI, or also perhaps, like I mentioned, scenarios for discussion internally in the project, or other examples, and you can have a look in the guidelines. So yeah, I just mentioned that this will be evaluated, and it will not detract from the overall scoring, but it will contribute to it. So if you have a substantial ROI part where you advance these ROI-related processes as well as this science, then that will be favorably evaluated. So you can also see that ROI is not only, for instance, about dissemination or creating acceptance. It's not only about the impact. It's also a part of excellence in science. So excellent science is a socially responsible science. So we will look, or the evaluators will look at the actual content and substance of ROI as part of excellence, and also look at the impact of ROI and how it contributes to the impact of the project in a positive way, of course, and then also how it is implemented in terms of that. Is there, for instance, expertise in the project, and is it resourced? Yeah, so there are many places where you can look for additional resources as well. There are some examples here. They're also to be found in the guidelines, so you can have a look there. So I think that was what I was going to say. It was a bit quick, but I guess that was okay.
Thank you.
Any questions?
Thank you, Ellen-Marie, for your presentation. Do we have any question? It seems to me that patient association are mandatory to be part of this project.
Yeah, so in that, for exactly that part, will be an overlap of the requirements, the general requirements to the call and the RI
Well, but
aspects.
yeah, patient association are not mandatory. Your consortium will not be not eligible because you don't have patient association in your consortium. They're strongly recommended, but it's not mandatory. There any? No, I don't see.
I think maybe we can come back to also the commentaire from Salvatore Di Somma earlier. He mentioned that for FDA and EMEA, highly recommend patient association to be a part of any research funding project in order to qualify it. They also recommend the patient association to be compensated for it. So I'm quite confused on previous statements. So what I was mentioning is that all funding organizations doesn't allow the funding of patient organizations. So the rules of funding organization doesn't depend on FFDA and MEA recommendations. So it's really important to ask to the national contact point of the national and regional funding organizations to be sure if the patient organizations are eligible for funding. And if not, well, we propose you to integrate patients in some different ways. Like, for example, advisory board. So it means that the patient association will not have so much tasks to do. It will just be consulted, and you can get the opinion of the patient organization on your project and can co-create together, I would say. And yes, I hope that this is clearer, but we, as ERA4Health, we are working to find a way to support patient association, but for this call, this is not yet implemented. We will do so for the second phases.
Thank you, Martin. If there isn't any other question about RI, we will keep going with the. Okay. Oh. Does this mean the patient organizations are not mandatory but can be a member of the consortium? Yes, the patient organizations are not mandatory but can be a member of the consortium. Oh, all right, Martin, I think you can start.
Okay. So the last presentation is about the evaluation criteria. So there is 3 evaluation criteria: the excellence, impact, quality, and efficiency of implementations. However, it's really important to note that independently of the score obtained, if the proposal is not under the scope of the call, this proposal will not be able to get some funding. So each evaluation criteria present different sub-criteria that we are going to review now. So the excellence. So the excellence is the scientific quality of the proposal, significance of a research question, clarity and relevance of the objective, credibility of a proposed approach and methodology, expected progress beyond the state of the art and clear demonstration of innovation potential. When we prepared this call with different experts, they identified different gaps which need to be solved according to this topic. So these gaps are the following one, but if your proposal doesn't tackle one of these gaps, but is still within the scope of the call, this is fine. It's just to give example. So it's important to understand the temporal sequence in multi-organ failure, the sex-specific differences in organ crosstalk, the characterization of molecular pathways between heart and other organs, reversibility of organ damage, and the elaboration of predictive tools to harness drug-induced cardiotoxicity. And in terms of approach, especially the digital disease modeling, we are in a stage where it's really important to integrate multi-scale data, meaning data about physiology, biology, or socio-economical different parameters, to have a better interoperability between different modeling platforms, and also a better integration of molecular to clinical scale data and validation protocols for digital models and digital twins. A part of the scientific excellence, there is also the quality of the project consortium. So it's really important to demonstrate previous collaboration efforts before, so like scientific papers or different grants, demonstration of benefit of working together, and the unique contribution of each partners, including expertise in different disciplines, and also gender balance. And the second sub-criterion of excellence is the novelty and the ambitions. So it's really important to generate a credible roadmap, how the result will contribute to a solution for the disease studies, or citizen patient-centered approaches, bedside to bench approach. So for the low TRL, maybe you think that it's difficult to show how this research will contribute directly to the solutions, but you should it's really important to envisage this when even with some low TRL. Second impact, so with the first sub-criterion is unmet public and societal need and potential impact for future clinical, public health, and or other socioeconomic health relevant applications, including patients' needs and our industry. So here it's important to write some details on the medical needs and societal impact and cost, the existing patents, documented experience in translational research, at the PI level, but in addition to the institution, the involvement of industry as partner, collaborator, or advisory board, and the inclusion of clinical scientist expert. the add value of a transnational collaboration and potential for fostering international network. So it's really important to highlight the resources which are going to be sharing, the set of data which can be harmonized. Also, it's important to use existing data, human biological material, whether by producing new when it's already available. And this is also similar for animal experiments. And the complementarity of the consortium is also important, and it's better to avoid redundancy expertise. The project, so this is really specific for the project with high TRL. So in this case, it's really important to plan for regulatory approval, for patenting, clinical testing, also to have a business model with awareness of existing patent and competitors, and also to have a scaling up strategy. Then it's really important to engage end users in the research process from conception of a study to implement and disseminations. So it's just what Hélène Marie just presented us. And as we also mentioned several times now, that end user can participate as partner when eligible for funding by a national regional funding organization. However, you can also ask them to participate as collaborators. So then in this case, they will participate with their own budget or as part of an advisory board. Here you have sub-criteria E, which is in light blue. It means that this criterion will be evaluated only in the second phase, so when you will write the full proposal. The quality and efficiency of an implementation plan include the feasibility of proposal and likelihood of successful completion of proposal research. So it's good to be ambitious, but it shouldn't be over-ambitious. So also it's important to have a really clear unmet medical need with a approach bedside, bench bedside, the main ID and technology readiness level, contribution to solution for patients. And so it's more easy to convince the reviewers if you have some preliminary results. So when it's low TRL project, it's good to have some basic research evidence or in vitro. When for higher TRL, it's better to have in vivo or in human evidence. Coherence and effectiveness of a work plan. So the aims of the proposal should be clearly stated. It should have also appropriate budget according to the size of the consortium. Clearly, and also not only in terms of budget, but also number of partners to be able to perform the aims and reach the objective of project. It should also clearly present work packages as connecting to the aims, specify work package leader and structure, specify the role of each partner in the work package with a balanced repartition or distribution, and a clear and informative Gantt chart of work. And it's really important if material and cohorts are already available to use them. Otherwise, you should very well justify why you are doing collecting new samples or creating new cohorts. Appropriateness of a management structure and procedure in clinical risk innovation management and RI and ethical consideration. So the E and F will be evaluated only on the full proposal stage. So it should have an appropriate distribution of resources in relation to the project activity, partners, responsibilities, and time frame. Co-funding always desirable and necessary sometimes when it's some permanent PI from the institution, partial coverage of consumer, or it can be also some intramural funding. Co-funding from industrial partner can also be quite beneficial to the project. If new data are generated or new biological material, animal or human, plan to share it in the database and biobank also is really important. And risk assessment should be made with pitfalls and mitigation. So this is for this evaluation criteria. Thank you for your attention. So I think now we can.
Yeah, we can now answer some questions. There's quite a few questions in the chat box. Someone asking, are the relationships between environment and cardiovascular disorder may be included? In this case, no. Environment and CVD interaction are not included in this.
Well, it depends how they consider environment. For example, the socio-economical parameters can be taken into consideration, like different level of salary or different geographical living environment, or such a thing can be taken into consideration.
All right, thank you. Can the same partner apply for different research projects? So one PI can apply as can apply one project as a coordinator or two projects as a partner. In reference to the question about fetal CVD, does the scope also include CVD in neonates? Yes, as long as, again, it's an interaction with another system and organs, it will be eligible. Is the pre-proposal already available? If yes, where? So the pre-proposal template is available on the ERA4Health website on the InterHeart webpage. It's also available on the PT Outline platform. When you connect to your account on the project description page, you can download the pre-proposal template. On the ANR page, Turkey is not in, but on the template, yes, which information is correct. Turkey is participating to the call. They were the last funding organization to commit. That's why the information was not already available when it was published on the ANR website. But Turkey is participating to the call, and it is an underrepresented country. If a partner for less represented country is included, which is the minimum number of partners required? The minimum number of partners required is always 3. You need 3 partners from at least 3 different countries, no matter if you have a partner from an underrepresented country or not. Will the recording be shared and where? Yes, the recording will be shared on the ERA4Health website. Is the call only for this year or could be renewed next year? We do not know the topic of the next call. This call is not meant to be a recurring one. Do you have any more information, Martin?
It's likely that each time the call will be new topic.
So no, it will not be renewed. If a PI has already requested another ERA4Health call like Effect Trial 2025, can be also a PI in a proposal for InterHeart. As long as it's for a different project, there is no double funding, so it has to be a completely different project, but I believe you can apply for another call. Is that right?
Yes, in terms of ERA4Health rules. However, it's always important to consult the national and regional funding agency or organization to be sure.
Yes, that's right. The organization may have specific rules on that matter. So recording presentation already answered. The INR does not particularly support oncology, and it's okay, but this project seems perfect for cardio-oncology. Do you share this opinion? Well, Well, I'm going to let Martin answer on that, but ERA4Health is not meant to support, oncology is not a topic for ERA4Health overall.
Yes, we didn't put any exclusion about cancer right in the call text.
We did not.
So in this case, this can be eligible. It depends how you're going to study. Maybe write us to specify it a bit better.
And there is no other question in chat box. Let me check the Q&A chat box. No, nothing new either. Oh, it doesn't seem there's any more question. So
maybe Salvatore is still present. Maybe you can give him the floor. You wanted to.
I can't see him in the attendees because I was trying to give him to see how to activate his microphone, but I can't see him. I think he left.
Yeah.
Okay, well, thank you everyone for attending this webinar. We hope that we answered most of your questions and that everything is more clear for you. Again, if you have any question, we are here to answer by email or by phone. And thank you for coming. Goodbye.
Thank you. Bye-bye.